Come in.
Hi, Mr. Kellett. My name is Ursula Kellett, and I will be your student nurse for today. First, I'm going to wash my hands. Please tell me your name and date of birth.
Mason Kellett, 3194.
All right. So today I'm here to do your physical assessment, if that's okay with you.
Yep.
Okay, so we're going to start with your head and go down to your toes. First, I'm going to inspect your scalp for any discolorations, abrasions, lesions, or any infestations. And now I'm going to palpate your frontal and maxillary sinuses. If you could tell me for any pain or tenderness. These are your frontal, and these are your maxillary.
No.
Okay, I'm going to go ahead and palpate your pinna, your ears for any pain or tenderness, and inspect your ear canals for any cerumen or wax. Alright, now if you could look straight at me, I can see your eyebrows and eyes are symmetrical to your face, your eyes are equally round to each other, and your nose is midline to your body. If you could look straight at me, I'm going to check your pupil's reaction to light. Okay. And look up and down. Your conjunctiva is pink and moist, and your sclera is white and moist. Now, if you could look at the top of my pen, to the wall, and back to the top of my pen. And now I'm going to do your 6 cardinal gazes. If you could watch the top of my pen with your eyes. Okay, so your eyes are perla, which means that the pupils are equally round and reactive to light and accommodation. Now I'm going to check your nose. If you could flare your nostrils for me. And they flare symmetrically. And I'm going to check your patency. Sniff in. And sniff in. And please look up. I'm checking for your deviation of the septum, and your mucous membranes are pink and moist. You have no temperature or diaphoresis. Your skin is consistent with the rest of your body. There's no abrasions, lesions, and your skin is warm and dry. And I can see that your lips are pink and moist. There's no cracks or lesions or abrasions. If you could open your mouth for me, lift your tongue and side to side. I can see your tongue, gums, hard and soft palate, mucous membranes are all pink and moist. Your tonsils and uvula are intact, and your teeth are white and straight. Next, I'm going to move on to your throat. If you could look at me, I can see that your trachea is midline with your body. And I'm going to palpate your thyroid for any masses or enlargements. Alright, now I'm going to listen to your carotid artery. You'll do this bilaterally on each side. Alright, what I was listening for was any bruits or stenosis, which is a narrowing or blockage of a vessel. Now I'm going to move on to your anterior thorax. I'm going to palpate for any pain, tenderness, or masses. And I can see you have no temperature or diaphoresis. Your skin is warm and dry, and it's consistent with the rest of your body. It has no lesions or abrasions. If you could breathe in for me. And I can see that your chest rises and falls symmetrically, and you're not using any of your accessory muscles to breathe. Next, I'm going to auscultate your 8 lung fields in the front. I'm going to be listening for any wheezes, crackling, or bronchi. If you could breathe in and out each time, please. Okay, now I'll be auscultating your cardiac valves. Your heart is located in between the 2nd and 5th intercostal spaces. First, to the right of the sternum is your aortic valve. To the left of the sternum and the right of the sternum in the 2nd intercostal space is your aortic valve. The left of the sternum in the 2nd intercostal space is your pulmonic valve. Left of the sternum in the 3rd intercostal space is your Erb's point. Left of the sternum in the 4th intercostal space is your tricuspid valve. And left of the sternum in the 5th intercostal space is your mitral valve. Also left of the sternum in the 5th intercostal space as the midclavicular line is going to be your apical pulse, which is your PMI or point of maximal impulse. And what I was doing was I was just auscultating your valves for any dysrhythmias or murmurs. Now I'm going to move on to your upper extremities. I can see that you have no diaphoresis or temperature. Your skin is warm and dry and consistent with the rest of your body, and there's no abrasions or lesions. We're going to check your brachial pulse and your radial pulse, which is on your right, the thumb side of your arm. I'm checking your turgor of your skin for tinting, and if you did have any tinting, it'd be a sign of dehydration. Your capillary refill is less than 3 seconds, and there's no sign of clubbing. And now we're going to check your range of motion and strength. This is flexion, extension, abduction, and adduction. If you could press on my hand to the side, and up. And you'll do that both bilaterally on each side. Next, we're going to do your breast exam. Do you know how to do one?
No.
Okay, so even for men, you should do this once a month. And sometimes it's easier to do it in the shower because the soap and water gives you an easier motion than out of the shower. You also need to do this laying down because you can find things laying down than you would normally find standing up. First, if you could just put your arm behind your head. We're going to start in your axillary line, making small circles, counterclockwise, and then spiraling until you get to your nipple. And just do a little squeeze just to check for any discharge. If you do find any masses or enlargements or any type of discharge, please notify your physician immediately. Now we're going to move on to your posterior thorax. I'll be listening to your 10 lung fields, checking your spine and your lateral lung fields as well. Okay, I can see that you have no temperature or diaphoresis. Your skin is consistent with the rest of your body with no lesions or abrasions, and your skin is warm and dry. Your spine has no sign of scoliosis, lordosis, or kyphosis, so it's midline to your body. You could breathe in and out each time, please. I'm going to auscultate your 10 lung fields. Okay, and your 4 lung fields laterally on the right side. Okay, great. Now if you could please lay down for me, I'm going to check your abdomen and your lower extremities. Now I'll be auscultating for your bowel movements. Your bowel movements are characterized by gurgling sounds. They could be hyperactive, hypoactive, or non-existent. Hyperactive will be an excessive amount of bowel sounds. Hypoactive is a lesser amount of bowel sounds. And then to clarify, for no bowel sounds at all, you have to listen for a total of 5 minutes to say that they're non-existent. So we'll start with the lower right quadrant, the upper right quadrant, the upper left quadrant, and the lower left quadrant. I can see your skin is consistent with the rest of your body with no lesions or abrasions. You have no temperature or diaphoresis, and your skin is warm and dry. I'm going to palpate lightly to feel for any pain, tenderness, or masses. And deeply palpate. Alright, now I'll be checking your lower extremities and calves. I can see that you have no temperature or diaphoresis, no lesions or abrasions, and your skin is consistent with the rest of your body, and your skin is warm and dry. We'll check your dorsalis pedis pulse, your posterior tibial pulse. Your capillary refill is less than 3 seconds, and there's no sign of clubbing. Your calf muscles. Now we're going to do your range of motion and strength. This is flexion, extension, abduction, and adduction. If you could press up for me, press down to the side and back in. And you will do that all bilaterally on each side. Now you can sit up for me. Do you have any questions or concerns?
No.
Alright, well thank you, Mr. Kellett. You have a nice day.
Thank you.